Welcome to the BioNexus Health podcast with Dr. Jodie Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health podcast, Dr. Jodie Dashore.
So, Andrea, this is becoming a really robust discussion, right? So we are going to have to go today, into this as part two, and like excellent question. So, if you can please proceed with your next question.
Yeah, well, my next question is referring to treatments. So we discussed all this, that it's out there selling, miraculous cures and everything. What would you advise parents about real treatments to look into? I must confess, I'm also one of these parents, and I see it happening very, very often in social media, that someone will state, oh, I've started these supplements for my child, and 3 days later, my child started speaking, or 3 days later, my child life, turned upside down. And then you see, I don't know, maybe 1,000 comments of people, oh my God, send me the link. Where did you buy it? I want to try it. So, since today we really want to empower our parents who are watching, can you please give us a bit of enlighten us, please, on which ways should we go? There is homeopathy out there. There is biomed, antibiotics, natural treatments. Could you please give us some suggestions?
Yes, that is again an excellent question. This is, all of the options you suggested are viable options, good options. But the important thing is it good for your child? So, yeah, it always needs to be personalized. Again, there is never going to be a miracle cure. This is the reason why the autistic genome was mapped. And the goal behind that project was that, hey, maybe we'll find a couple genes that cause autism, and we can research, genetic engineering, and see how we can support children diagnosed in that manner. And what did they find? Like, voila, there is 100+ genes that are problematic in children with autism. So there is nothing that can be a miracle cure. But understand this: genetics just loads the gun. Epigenetics pulls the trigger. So the choices you make in your life for your child will pull the trigger. Don't go crazy. Oh my God, my child has this genetic condition, Fragile X, etc. Right? That's it. There's no hope. Of course there is hope. No. He has autism and all these genetic issues. That doesn't matter. But it runs in the family. That doesn't matter. It will, oh, we have MTHFR, we have CBS, we have methylation problems, we have CA. Okay, I get it. Take a breath. You need to proceed step by step. And it is important, again, to run the labs, see what is going on with your child, understand the situation with your child. Hey, we are looking at 12 infection. Like with my son, we had 18 infections, and we had about 21 toxins in the body. There was this, 5 toxins that the lab couldn't even name, except that, these toxins had a benzene ring, but we cannot name what they are. Who knows? Because they probably became mutated, in the body for so long. It's just mind-boggling what happens with our children, and how much cleansing they might require. So it's important to come up with an individualized plan for your child. Run the labs, look at what's going on, and then, homeopathy is a good option. Honestly speaking, I haven't seen lasting results with homeopathy, even at the hands of an extremely skilled practitioner. I have seen remission with homeopathy in the hands of a very skilled practitioner, many years, right? But I have not seen long-term fix with homeopathy, especially with the single remedies. It's just, it becomes difficult, even with homeopathic star codes and nosodes and tonifiers. I use them in my practice in conjunction with the herbals. And of course, I've tried all of these for my son as well. What I found was that antibiotics in an acute situation with proper support, gut repair, are helpful, but not for long term. You can't be doing antibiotics for autistic children for a month, for 6 months. It's just they already have compromised guts. So bottom line is herbal medicine is very powerful. And herbal medicine, when it is properly targeted, it can help overall.
And in the long run.
In the long run, exactly. Yes, well said, Andrea. So whatever gains you see with herbal medicine, herbs always do their job. You see the labs before, you see the labs after. Boom, infections are eliminated, things. If you acquire new infections, go back to herbals, they will also be eliminated. Now, the thing is, elimination does not mean repair. So elimination does not mean that, all the symptoms will be gone just with elimination. No, many symptoms will be. But for repair to occur is very important, so that in the long run, 10 years from now, 15 years from now, this problem does not come back. Of course, there will be re-exposures and flare-ups, right? But once you handle the flare-ups, there is no permanent regression. Whatever gains are made with herbal medicine, they stay. And they will always come back, even after a flare-up.
Yes, indeed.
What...
Let's discuss a bit about the testing, since you've already mentioned it. I would like to ask you, is there a test that can show us that children actually are autistic? And then what about the role of inflammation in autism, and how do we test for inflammation? And another question, especially, for families who have one autistic child and they would love to enlarge their families. I want to ask you, how should you test yourself as a mother to be? To see if your child is going to have autism or not? Is there anything available?
The diagnostic panel that the neurodevelopmental pediatricians or neurologists use to diagnose autism, that is the known testing out there for autism. If you want to buy it, good. I don't buy it. Not until, and I'm not saying that there is no autism at all. These are valid tests. They give us valuable information that there is something going on with our child that needs to be addressed to avoid long-term complications. But at the same time, it would be foolish not to understand that there are several medical conditions, pediatric medical conditions, that have been discovered in the last 20 years, 15 to 20 years, I should say, that mimic many of the symptoms that are known as symptoms of autism. There have been a couple research studies that, looked into hand flapping.
Yes.
And let me ask you this simple questions, right? The term that your foot or your leg has gone to sleep, it's become numb. What do people do, when you're sitting for a long time and your leg goes to sleep or foot goes to sleep? What do? You just shake out your leg and you tap your foot, right?
Yes, yes.
And you stand up and walk around, gets better. Well, when there is underlying Lyme disease, which means it attacks the nerves, which means possible neuropathy, which means tingling, numbness, vibration, symptoms, the same symptoms like your leg goes to sleep in the hands. And what do children do? They shake it out to see.
Wow, that's amazing, actually, because I was always wondering what's hidden behind that.
So there was, this is Dr. Robert Bransfield, MD. He's been the head of the American Psychiatric Association a couple times. He's been the head of ILADS a couple times, one of the founding members. He did a research study with a school teacher, if I'm not mistaken, in Idaho or Oregon. But this was presented in the 2012, all the way back. ILADS conference, and I was one of the speakers there. That's how I was attending Dr. Branfield's session, and his work is he's a legend, Dr. Bransfield, in the field of Lyme and autism, etc. And that's what they saw, that children with Lyme-induced neuropathy mimicking hand flapping, it went away. It went away in the son of the special needs teacher who was in the same classroom and several other children. So they were able to pinpoint which child or which children had underlying infections strongly, right? Because when they were treated with like a couple weeks of antibiotics along with probiotics, the symptoms were gone. The hand flapping was gone.
Yes.
Right. And they saw, some additional benefits. So this was really eye-opening. That was just one example. So it is important to understand that pandas, mold, biotoxin illness, Lyme disease, co-infections, they can mimic the brain inflammation, brain damage symptoms, the gut symptoms that come with autism. So once if your child has any of these underlying conditions, then you can see significant improvement in the symptoms, because what happens is, let's say, let's give 100 points to autism, right? So your child gets 100 points. Hey, he has 100 points of autism. He's autistic. Okay. What I see in my practice is, once we run the labs, anywhere from 50 points to 80 points is the symptoms are actually coming from underlying problems, and only 20 points is the real underlying remaining autism. So do you want to deal with 100% autism or 20% autism? Put in a little work, put in some resources, and help your child. Help the family. So there is a very scientific logistic way that you can follow along and see, here's the before labs, here's the after labs for your child. That can be done, and there are natural treatments. It's like science meets nature. There are natural treatments that can be done for your child, because we know that children on the spectrum don't really do well with pharmaceuticals for various reasons. Detox pathways, the methylation pathways are affected. There is mutations, and there's gut issues. There's autoimmunity issues. So there are various reasons why pharmaceuticals are not a great idea in the long run for our children.
That's true. So let's say that I'm a parent of a newly diagnosed child, doctor. So which test should I start with? Should I start by testing the gut? Should I start by testing my child for Lyme? Should I do, I don't know, some sort of a mold test for my house? Which are some of the, can we name some of the most important when you begin, let's say, in
Well,
treating your child?
all of the above, Andrea, because it is important to get everything is interconnected. So it's important to get a complete 360 view of what's going on with your child. One simple example would be infection, like Lyme disease. And
Yes.
nobody gets just borreliosis, right? There's always co-infections. So if you get an infection, that it's understandable you're the host. The child's body is the host for that infection. Now, the host body is going to be depleted of nutrition. There's going to be, obviously, because the bacteria want to live. So, you get depleted, the body gets depleted. Then additionally, the byproducts of the bacteria, the reproductive byproducts, the elimination, the bacteria have to evacuate as well because they are living organisms, right? So all of these byproducts and endotoxins that are released in the body, they cause damage to multiple systems in the body. And they cause inflammation in the body. Okay. So as long as there is damage and inflammation, it is nearly impossible to detox the body from environmental toxins. And vice versa. So if your child has underlying infections and you're like, hey, I'm going to look at mold, great. Investigate your environment, eliminate the mold in the environment. That's beneficial to the whole family, because obviously if the environment is contaminated, it's not a miracle that only your child gets affected. No, everyone is being affected. It will manifest in your health eventually, especially with the stress of having a child on the spectrum. But that is, the health of mom and dad is a whole other topic, but it's very crucial, right? So don't bury your head in the sand, like, don't wear blinders that, hey, it's just my child. No. If there are environmental toxins, you are all being poisoned. Your mature immune system might be handling it, but that doesn't mean background damage is not happening. It happened to me as well, right? I mean, I went through my pregnancy. I had no clue that, there was mold, there was Lyme, there was co-infections and parasites and all of these toxins that I'm going to pass to my child. I was symptomless. I was doing great. I was doing well. I was going to the gym 2 hours a day, great shape, so yeah, I mean, I was in the gym like a few hours before labor. I wasn't, for all practical purposes, I was in good shape. So anyway, so that's mom and dad's health. That will be another topic for discussion. But as far as testing goes, you can do step by step, but don't expect to see lasting improvement unless we have a full picture of the child, right? If you have a tumor, if it is cancerous, don't they run a full body scan to see if it has spread?
Yeah.
That people can accept. But when you come to say that, we need to look at the multiple systems that have been poisoned by the toxins. So that is where you look at multiple systems and you create a personalized, biological matching protocol for your child. And that's how you proceed.
Yes, indeed. Thank you so much. Part of my question was also, is there one test available today for mothers to be, allowing them to know whether their child is going to be autistic or not?
Yes, that's such a beautiful and important question, right? Now, it's been interesting that in my practice, I've been getting mothers for whatever reason, right? From their family or friends who have a child on the spectrum, or they know someone who works with autistic children, special needs children, that they find out. And now it's younger and younger. I've had moms coming to me with their children at 5 months of age. I have a child
Wow.
with a full body rash. He's not eating. I'm being told it's allergies. Nothing is working. Allergy medicine. They're giving him antacids. I know antacids for a child, like proton pump inhibitors. These are not good for a 5-month-old. Really? I'm scared something might happen. And then, so I'm getting these mothers bringing their children to me 5 months, 7 months, 10 months, and we're seeing complete recovery in these children. So at that age, if you bring the child, that is the only exception I can tell you that, more than 95% recovery is seen within a year or less, maybe 18 months, but within 1 to 1.5 years. I remember Brixton was 5 months with head to toe rash, couldn't eat, was pooping 22 times a day. You're not eating. What are you pooping? Your intestines out? I couldn't sleep. And now at 2 years of age, he is, he is your typical toddler in his terrible twos. He comes on the Zoom call. He's like, "Hi, Dr. Dashore," and then he runs and he's playing peekaboo with me. This is the same child. So he's recovered phenomenal. He has 2 older brothers on the spectrum. So his mom was really heartbroken when she saw problems with this 5-month-old, and she brought him to me right away because her best friend's son has made a fantastic recovery on the BioNexus protocol. That's how she heard. So that's one. Then there was another mom who heard about me some other way, and we started with the son at 10 months. And Andrea, he had physical problems like Brian and Arthur have had, right?
Yes.
Really weak, arms, legs, muscles in the face, couldn't chew. And he's recovering really, really well. He's running around, got stronger, and he's always smiling. He's listening. He comes on the Zoom calls. So younger, the better. And your question was, the program that I have in my practice is preconception, detoxification, and balancing the body. So it's like, resetting the mother's body, investigating, of course, for the mother's own health as well. I have one mom in Trinidad and Tobago, amazing family. The older daughter on the spectrum started making really good recovery. Mom wanted to get investigated before she tried for another child. She asked me, is it always that my child will be on the spectrum or, have any special needs? But no, that is not necessarily so just because you have an older child. If you clean and reset your body, right? So we ran the labs. My goodness, there was so many problems with this poor mom. And she was already in the mid-30s. We know that if the underlying issues with Lyme disease, and mold are not treated, then in the 40s, you're at a very high risk for multiple sclerosis, Parkinson's, Alzheimer's, dementia, as your age gets older, Crohn's, colitis, a lot of problems can happen to us as we get older if the underlying issues. So she obviously wanted to be treated, but she also wanted to get pregnant. So we started treating her, and then she got pregnant. I mean, it's God's gift, it happens. So I switched her to a custom protocol for pregnancy so that the infections would not be passed on to the child. And yes, of course, there are supplements and herbs that can be safely used during pregnancy That is why you need a master herbalist who understands herbs properly. The baby, and mom had a fantastic pregnancy. I mean, literally, there was no morning sickness, no aches and pains, no blood pressure issues, no diabetes, not even anything. Fantastic. She was happy, no anxiety, no nothing on the herbal protocol. Pregnancy went smoothly. The birth was fantastic. And the baby boy is doing really well. Breastfeeding went really well. We had mom on herbs. So he got the herbs in utero and he got some herbs during breastfeeding. And now that he's weaned off at 6 months, we can go full throttle and treat mom. So mom is going to be healthy as well as she gets older.
That's wonderful news. One of my questions.
Thank you for joining Master Herbalist Dr. Jodi A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugged. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.